I'm Dr. Enrique Feria, and I'm an orthopedic surgeon specializing in foot and ankle surgery, working for the Salt Lake Orthopaedics Clinic. So the kinds of procedures and conditions that I treat, it's truly the full spectrum of foot and ankle pathology, and I deal in both the non-operative and operative management of all. So it truly goes from anything as simple as a bunion deformity to something as complex as ankle arthritis. If it's something that's trauma related or sports injury related, such as like an Achilles tendon tear or an Achilles injury, whether it's your toes, whether it's your foot, whether it's your ankle, anytime you're having pain, deformity, or you're starting to develop ulcers that require medical attention, I truly treat the whole breadth of foot and ankle. I typically recommend patients come see me, number one, if they've had an injury to their foot and ankle and it's been more than 48 hours and they're still having, whether it's pain, whether it's swelling, whether it's any painful clicking or popping, that's generally something that should probably be thoroughly worked up by a foot and ankle orthopedic surgeon. Number two, I think also if it's not an injury per se, but someone who's had pain that's worse with activity, that is typically something that should be worked up with imaging and a formal physical exam by a foot and ankle surgeon. And number three, I think this one's important because it's not necessarily something that is causing pain, but if you have a blister or an ulcer in your foot, even if it's pain-free, it's probably something that warrants further workup just because it could be indicative of some underlying deformity or even something a lot more serious that requires intervention quicker and should be worked out by a foot and ankle surgeon. One of the surgeries I do offer is total ankle replacement, and with the newer technologies that we offer nowadays with ankle replacements, patients are doing extremely well in getting back to all sorts of activities, including skiing, golfing, hiking, and it's truly something that we've made a lot of progress with in the past several years. And if that's something that you've been told you have ankle arthritis, I'd be happy to see you and talk to you about the possibility of potentially doing an ankle replacement. I also pride myself in being a native Spanish speaker and being able to be a doctor that's going to advocate for the Hispanic population in the greater Salt Lake area. So if you're having any pain or symptoms regarding your feet or your ankles, please give our clinic a call, and I'd be happy to give you a formal evaluation and let you know what the next steps would be in getting you back to your previous quality of life.